Causes of hypertension. We have talked about primary and secondary hypertension, and we said primary hypertension does not usually have identifiable causes, but it is associated with some risk factors like genetics and lifestyle factors. Now, secondary hypertension, we said, is usually associated with some medical conditions and drugs or medications. Now, causes of hypertension. There is what we call arteriosclerosis. Arteriosclerosis is the thickening of the blood vessels. As a result of age, blood vessels thicken. And when this occurs, the blood pressure consistently goes high. It is a factor that can occur in every individual, even though it is not all aged or old people that are hypertensive. So age is a factor that comes into play when we talk about arteriosclerosis, whereby there is thickening of the blood vessels. And when this occurs, it reduces the internal space, the internal diameter of the arteries. And what happens? The pressure with which blood passes through these arteries increases, and that leads to hypertension. Also, there is what we call atherosclerosis. Atherosclerosis is the deposition of fat in the walls of the blood pressure. Deposition of fat is usually brought about by fat accumulation and high cholesterol level. So when there is high cholesterol level and fat deposition in the blood vessels, it reduces the internal space of the blood vessels. And this is the internal diameter. And once this happens, it increases the pressure with which blood has to pass through these vessels. And it results in high blood pressure. Kidney diseases. Kidneys are major organs responsible for regulation of blood pressures. We know that kidneys filter blood. Blood is passed into the kidneys. When blood circulates into the kidneys receive the blood and filter the blood. When kidneys filter the blood, they filter urine out, they filter toxin out, and return the blood back into the system. This is the major work of the kidneys. So when the kidneys have problem, definitely the work of regulating blood pressure will be affected, and there can be increase in blood pressure. Another cause of hypertension is adrenal gland disorders. Adrenal glands are responsible for production of hormones that have effect on the blood pressure. Also, thyroid glands. When there are problems with the thyroid glands, there is bound to be high blood pressure, especially when there is hyperfunctionality of the thyroid glands. Hyperfunctionality of the thyroid glands makes the functionality of the body generally to increase, because thyroid glands produce hormones responsible for majority of functioning in the body. So when the thyroid glands are hyperactive, they produce the hormones in high quantity. These hormones increase all the activities of the body. There may be too much heat in the body because the body cannot regulate the temperature any longer. If there is hyperthyroidism, that is high functionality of the thyroid glands, it increases the blood pressure also. It increases the pressures in the brain, it increases the pressures in the eyes, everywhere. All the functionality of the body is in excess. That results in a condition that is called goiter. Goiter is the enlargement of the thyroid gland. The thyroid gland itself can be enlarged. So this is another cause of hypertension. If there is obstructive sleep apnea, there can be hypertension. In obstructive sleep apnea, the person, individual just ceases breathing occasionally. The person could be sleeping. In sleep, the person just stops breathing. So if you happen to be with the person, you are the one that would observe that the person stops breathing occasionally. You expect that, okay, this person is breathing regularly. All of a sudden, the person just ceases breathing and is not breathing for an extended length of time in seconds, and before you know it, the person could come back. If the person is sleeping, the person eventually wakes up and from sleep and begins or continues to breathe. Another cause of hypertension is constriction of the aorta. The aorta is the upper part of the heart, which the heart pumps blood through as the blood is pumped or circulated around the body. So if the aorta is constricted partially, it increases the pressure with which the heart pumps the blood eventually into the body, and that leads to hypertension. Then there is what we call gestational hypertension or pregnancy-induced hypertension. In pregnancy-induced hypertension, there is high blood pressure in the woman as a result of pregnancy. That is why it had the name pregnancy-induced. That means that kind of hypertension is induced or caused by pregnancy. because there is disruption, in the hormones of pregnancy. It disrupts the general balancing of the body. There are lots of fluids and all that. There are so many things that occur in pregnancy that lead to hypertension for the woman. And usually when the woman gives birth, you will discover that after birth, the blood pressure goes back to normal in most instances. So there are factors that could be associated with pregnancy-induced hypertension. So risk factors for pregnancy-induced hypertension include obesity, when the woman has too much or too high weight, too much weight. So when the woman is too fat or there is too much weight, if there is chronic high blood pressure, the woman could be having high blood pressure before the pregnancy. That can happen. If there is diabetes also predisposes a woman to high blood pressure, even if she has not been hypertensive before she got pregnant. If there is kidney disease in a woman, it can also be responsible for hypertension. It can increase the chances of the woman having high blood pressure. If there is kidney disease, then it can predispose the woman to having high blood pressure even in pregnancy. Lupus erythematosus. It is an autoimmune disease. Sometimes when I was talking about miscarriage and infertility, I talked about lupus erythematosus. So lupus erythematosus is an autoimmune disease, and it can also be responsible for hypertension. If there is in vitro fertilization, the usual almighty IVF, it can also predispose a woman to high blood pressure. Any other similar procedure that can increase the chances of pregnancy-induced hypertension can increase a woman's high blood pressure. If the woman is getting pregnant for the first time, it is a risk factor. Of course, it is not all women getting pregnant for the first time that are hypertensive. But in first-time pregnancy, if a woman is 35 years and above, it increases the chances of getting hypertension or being hypertensive. Then if there is multiple gestation or multiple pregnancy, whereby the woman is carrying more than one baby in pregnancy, it increases the chances of the woman having high blood pressure. So high blood pressure during pregnancy can cause premature birth of the baby, early detachment of the placenta, which leads to bleeding.